How countries like America will end up like Italy if drastic measures aren't taken. The coronavirus gets more ominous by the day. The World Health Organization says it possesses a greater global threat than terrorism. Many countries saw little choice but to take extreme measures to slow the spread of the disease. Thousands of events have been cancelled. Schools, restaurants, bars and clubs have been closed.
Anything involving a big crowd is starting to be in
concerns
jeopardy.
about COVID-19.
NBA is suspending the season. I say that.
Now there's been plenty happening on...
Schools across the state will be closed for the next 2 weeks starting on Monday.
And even transit systems at airports are at a standstill. The case number exploded and in turn, so did the number of deaths. World Health Organization urged countries to test all suspected cases of COVID-19. However, despite weeks of notice, American officials are playing at the very low end and are scrambling to get a grip on a quickly approaching disaster. As the number of infections rose, residents in New York were struggling to get tested despite worsening symptoms. According to Fred Hutchinson Cancer Research Center computational biologist Trevor Bedford, there were as many as 1,100 cases in Seattle alone, and the virus may have been spreading since at least mid-January, long before any case was officially confirmed there, as Stats' Helen Branswell first reported. If the America continues to lag in its testing capacity, the number of cases and deaths will double every week. As it appears to be the case in Italy, then the country may soon be facing its own crisis. How Taiwan, Singapore, Hong Kong and South Korea deal with the outbreak. The strict monitoring systems in Singapore, Taiwan, Hong Kong and South Korea were built over years, after their failures to stop the dangerous outbreak of SARS, by which the United States disbanded its pandemic response unit in 2018. And even if the countries are closely interconnected with mainland China, with direct flights to the outbreak's epicenter, Wuhan, were using different strategies in battling the pandemic, they still are successful in minimizing the cases and deaths. Taiwan. After the SARS outbreak, Taiwan established a National Health Command Center with a branch that specifically focuses on large outbreak responses and acts as a central command post for direct, transparent communications. When the news about an unknown virus came out of Wuhan, China, on December 31st, officials in Taiwan immediately began restricting flights to and from the region and began to screen passengers. It expanded its assessment criteria a week after and began quarantining anyone showing symptoms. Despite its proximity to China and the frequency of flights between the two countries, Taiwan has only had 49 confirmed cases and 1 death. Singapore. Singapore's strategy of moving rapidly to track down and test suspected cases provides a model for keeping the epidemic at bay. Authorities quickly released online the details of where patients live, work and play, allowing others to protect themselves. Close contacts of patients are quarantined to limit the spread. The government further strengthened its borders this week to protect against a new wave of imported infections. Hong Kong. Hong Kong has seen fewer than 100 cases since the outbreak began, and so far its strategies to contain the coronavirus have prevented large-scale outbreaks. Schools and businesses are closed. All transportation services such as train, bus and ferry going to and from the mainland China is suspended, and the border with China is essentially shut down. People keep their distance from each other. Almost everyone on the street wears a surgical mask. Some of them even wear gas masks. People are also restricting themselves from doing handshakes. Moreover, to contain the spread of the virus, officials from the health department every day announce the addresses and occupations of people newly diagnosed with COVID-19 and call on residents who may have had contact with those people to come forward. South Korea. South Korea was one of the worst hit countries in the early stages of the coronavirus outbreak. But the quick and aggressive response has lessened the spread of the virus without locking down the entire cities. According to Chung Byung-chul, an epidemiologist at Korea University, High-risk patients with underlying illnesses get priority for hospitalization. Those with moderate symptoms are sent to repurposed corporate training facilities and spaces provided by public institutions, where they get basic medical support and observation. Close contacts and those with minimal symptoms, whose family members are free of chronic diseases and who can measure their own temperatures, are ordered to self-quarantine for 2 weeks. A local monitoring team calls twice a day to make sure the quarantine stay put and ask about symptoms. However, those who violate any of the quarantine rules will be charged up to 3 million won, $2,500 fines. You can help prevent the spread of COVID-19. A revised version of a recent study on the virus that was published on March 17 in the New England Journal of Medicine. COVID-19 can remain viable in the air for up to 3 hours. It can also linger on some surfaces, such as on copper, for up to 4 hours, on cardboard up to 24 hours, and on plastic and stainless steel up to 72 hours. The virus can also be acquired in all areas, regardless of the climate, hot or humid. According to the World Health Organization, since people of all ages can be affected by COVID-19, the best way to protect yourself is by frequently cleaning your hands. By doing this, you eliminate viruses that may be on your hands. Also, avoid close contact with anyone who is coughing and sneezing. More studies have shown that people with COVID-19 can spread the virus even when they display no symptoms, such as coughing or sneezing. You could have the virus but not know until 1 or 2 weeks later when the symptoms arise. Here at HotSpills, we urge viewers to please stay at home during this time, as much as you can, and only go out if needed, such as for groceries. Staying home is the best thing you can do right now to save lives. To know more about how to protect yourself and other people from the virus, you can visit WHO's page. Let's help one another. Thanks for tuning in. If you haven't subscribed yet on this channel, we encourage you to hit that button so you'll get a regular update on the current news and trends in the world. See you guys in our next video.